Nigeria, a low and middle income country, faces challenges in providing sustainable healthcare to its population due to inadequate financing, weak healthcare infrastructure, and insufficient human resources. More so, to achieve sustainability in the health sector, there is need for transformative plans and solutions that require cooperation among industries and the government through delivery of minimum set of costs, effective interventions, packages, and revitalization of the country's health system. However, the Association of Public Health Physicians of Nigeria has said that public health is now in danger under the current government of President Bola Tinubu. President of the association, Alphonsus Isara, stated this in Akure during the 40th scientific conference held last month. Isara noted that the Tinubu's government has ushered in an avalanche of public health issues threatening the healthcare delivery system in the country. Special Advisor to the President on Health, Dr. Salma Ibrahim Anas, said the administration of President Bola Tinubu is committed to the reform of the health sector in order to improve healthcare delivery.
Government should do everything possible to retain them by making conditions of service more favorable to them so that they can retain. If the health workforce is one of the most important building blocks of the health system, without the health workers, the health system cannot run. Health workers drive the health system. So most of our hospitals are empty now. Many of the health professionals have traveled. So the government should make the conditions better for them so that they can stay and help resuscitate the health system.
But we can't achieve universal healthcare coverage without some adjustment into what the current situation of health in Nigeria. So we are committed to reform the health sector with a view to ensure that we close the gaps between those in need of services and the available services, or expand the services, and also to ensure that we deliver quality healthcare services to the teeming populations of Nigerians.
Repositioning public health in a new political dispensation is not the responsibility of an individual, but the collective efforts of us all. There is no doubt that our country is currently facing serious challenges in several sectors, health inclusive. The challenges in the health sector has necessitated the need for all stakeholders to come up with new strategies to address them.
Meanwhile, in order to boost the healthcare system of Nigeria with specific reference to Abia State, a team of over 60 physicians and experts in different branches of medicine from North and South America under the umbrella body of Association of Nigerian Physicians in the Americas, ANPA, will hold a free medical mission in Abia State from April 4th to 14th. The mission is to complement the efforts of the state government towards improving the health sector in the state. Joining us now on the show is Professor Rukevwe Ugwumba, a Canadian-based professor of medicine and family health, a former special advisor on health monitoring to the Delta State governor. She's joined by Dr. Chinyere Anyaogu-Eziri, President, Association of Nigerian Physicians in the Americas, ANPA. Good morning and welcome to the morning show.
Good morning. Finally, good to see you in person,
Yes,
Ayo.
good to see you in person.
My big brother, Ruben, and
good to see you. Always.
Well, thank you and welcome,
welcome,
Dr. Anyaogu-Eziri. Thank you for joining us. Well, okay, quickly. This morning, we've been talking about Nigerian problems, the electricity sector, the education sector. Both of you are experts in the health sector, and you've had experience in other jurisdictions in North America. Now, the Association of Public Health Physicians in Nigeria, that association is saying public health in Nigeria is in danger. And we all can see it, all the health facilities in many parts of the country are not functioning. From your experience, from what you have seen, what do you think should be the main priorities of the Tinubu administration? What do we need to do from insurance to infrastructure to service delivery? We'll go one after the other. Let's start with you, Professor Rukevwe, and then we'll come to you, Dr. Anyaogu-Eziri.
Thank you, Dr. Abati. It's very, very obvious that financing health sector is critical for healthcare delivery. And so, first of all, in 2014, I'm sure we saw that the Consolidated Revenue Fund, where 1% of the entire budget will be put into the healthcare, mainly the basic healthcare provision for all Nigerians. And even as the 2018 under the previous president, that was passed into law and included in their budget, it was not implemented, okay, fully. So this is where the crux of the matter starts. We know that healthcare starts with the primary healthcare. So for the primary healthcare system to be functional, that's the bread and butter of medicine. You need to put funding to it. And so that's the beginning, funding healthcare properly. And this administration under President Tinubu has some experts in terms of the Minister of Health and the Minister for State of Health. They're from diaspora. And so, like you said in our introduction, we have worked in other climes, and we see how healthcare can work properly in America, in Canada, where I come from, and it's properly funded. There are different ways of funding healthcare, but there are lots of indigent people in Nigeria that cannot even afford to buy health insurance. And so that's where the public health system comes in. And so the primary health care is really critical to function properly before we talk about secondary and tertiary. In Nigeria, for example, if you have money, you don't even know who your GP is. In England, where I trained, you must have a GP. You can't just walk into a hospital except you're having a heart attack or an emergency. You must get referred from the GP, which is the primary health care, to the specialist. And a lot of people bypass that. And so this is where we have to get it right in Nigeria, where the primary health care, which is the general practitioner, if you will, the family physician, knows everybody in their community, is localized. So that even if you have a headache, you may think it's malaria, it may actually be hypertension and stroke. So when we get that right, if the healthcare system is properly funded and you have competence there, you have, confidence in your results, then you will see that the healthcare in Nigeria begins to work properly. You mentioned the AMPA, which I'm a part of, from Canada, and we're partnering with the Abia State government to do this huge intervention. I'm telling you, as I speak to you now, over $500,000 worth of equipment have come into Abia State, and the government has actually partnered with at least over 100 million naira for local infrastructure. This has been going on since the 4th of April to the 14th, and people have been screened for surgeries. I know the president, who is also my childhood friend, will talk more about AMPA and what their goals are. But I'm saying that government can do a lot of things, but it's not government alone, as you can see, this intervention. But the structure of government has to be right. We have to fund healthcare properly. We have to get the primary health sector to work, and we have to get referral systems. So even as we go to AMPA now, we're going to find a lot of problems which need follow-up, and that falls back to the state government with their primary health sector, to the secondary, to the tertiary, depends on the problem. And of course, little things like blood, donation of blood. We don't have good blood donation drives. I know there's some NGOs that are doing that. Things that you can't even buy because you need human participation. All those drives should be government funded, and initiatives should be there to make sure that those stopgaps are there. I don't want to talk about accidents on the road. That is a disaster because there's no emergent system. Many people die from very basic things like hemorrhage, things like we can easily fix in 30 minutes. There was a local primary health center that was functional to take care of them. So we have a lot of gaps that funding can do, proper organization of the health system can do, and everybody need to work together, both local, federal, state government, and even non-governmental agencies like the AMPA are coming in to do at the moment.
Professor Ugwumba, we get your point about funding, which is very important, with most Nigerians accessing the healthcare system through out-of-pocket expenditures. But let's hear from Professor Anyaogu-Eziri. Prof?
You have elevated that to Prof? Okay. She's a doctor.
Oh, okay. Well.
But Prof, okay. Go on.
Yeah.
Show your Prof.
Yes, thank you, everyone, and I'm happy to be here. In line with what Professor Ugwumba was saying, I think one of the things that we really need to look at that would help us in general in the country is understanding the interface between preventative health care and the workforce development. When we talk about preventative health care, yes, primary care is key, but the truth of wellness is actually prevention, meaning what can be done and what should be done prior to the actual illness content. So that would include healthy behaviors, early detection, preventative screenings for hypertension, diabetes, screening for cancer, screening for mental disease. As much as we don't naturally consider this as a primary cause, mental disease is a huge burden and actually could complicate your ability to care for other illness milieus. Preventative healthcare requires, however, the ability for us to have a level of health literacy that allows you to understand how to best deploy treatment when it's given, how to impact on what you can do within your daily routine, how you need to watch what you eat, educate yourself, have healthy practices, keep your BMI in check. These are all things that require you to have a level of health literacy that requires a development that requires also not just the government, but everyone within the circle of influence to have an understanding to be able to impact. People who are educated live longer. Studies have shown that. The education may require that you are able to defer instant gratification and understand the public health tenets that require you to prevent disease. If you look on the top 3 or 5 causes of death in Nigeria from 2019 in Statistica, aside from neonatal diseases, the one common and prevalent cause of death is malaria. And I think all of us regard malaria as something that we have to live with. But can you imagine a world where malaria is no longer present, where it's been eradicated? Some studies have indicated that over $1 billion a month is spent on direct costs from malaria. Now, if that money was taken away from the direct costs from malaria, and this does not include the indirect costs that include loss of wages, affecting the workforce, illness in the family, failure to thrive, and so on and so forth, all of that could then be put into other infrastructure and/or therapies that would be able to improve health in general. Malaria has been eradicated in the past in other countries. Nigeria represents almost 30% of the global burden of malaria. That's a huge degree. Now, when you talk about sustainable healthcare frameworks, it would include a situation where you have the adequate therapies, research development, the ability to utilize innovation to address the life cycle of the parasite and its environment to then equate to and actualize eradication. These are all things that are involved in when we talk about innovation and therapies. It doesn't have to be that far-fetched. We're not talking about going to the moon. We're talking about things that are able and currently residing in other areas that could possibly improve the healthcare delivery space to decrease the burden and the need for the lack of the workforce that's present. I say the lack of workforce because we all know that from WHO statistics, there's not enough providers, and I say providers loosely because it's not just physicians, members of the team that could be able to take care of the population at risk. So what do? Nigeria has a wonderful, highly trained university physician producing network. I say that I was trained in Nigeria. I think it's one of the best places that you could be educated. But it's not enough because there's a lot of people that require the care. And even if you wanted to train as many physicians for you to be able to manage the population, you need team members, you need allied, you need nurses, you need technicians, you need multidisciplinary approach and collaboration to be able to make this effective.
Let me come in here because we have a limited time and I want to get in as much as possible into the interview. Very insightful. Thank you so much to you both for just drawing that line. Professor Ugwumba, you center on primary health care, and I think that's absolutely spot on because for any nation's healthcare to thrive, you must have a solid primary healthcare delivery system. Now, you talk about funding when you were speaking, and if you look at the budget for this year under this administration, less than 5% of the budget has gone into healthcare. And that is for the entire, whether primary, middle level, or tertiary. How would you go about or suggest or recommend to maximize, despite the fact that we don't have a huge amount of money allocated in terms of the needs of the nation? How would you advise in terms of priority spending? What must be the immediate things to be addressed, especially in the area of public health and primary health care delivery?
So very, very good that you agree with me, because this is very straightforward. The primary health care needs to be properly funded. My colleague here, Chinyere, said that prevention is actually cheaper than cure, not just better. Because if you can prevent, say, for example, the malaria or the meningitis, because you immunize the child at the primary health center, the funding will be better implemented. First of all, they put things in budget, but not all the things that you put is utilized. So at the end of the year, even the 1% was never fully implemented. So we're talking 5% now across board. Less than. So I still think focusing on the primary health, because primary health is not just going to the center to get treated. It involves education. It involves environmental issues, like getting people, using mosquito nets and things like that. For example, she focused on the burden of disease and the cost of malaria to the workforce, and even deaths from malaria. Even malaria causes anemia, which is low blood, and anemia actually kills, especially pregnant women and children. So all these statistics show that primary health care is the bread and butter of medicine. And so that's, for me, that's where the money should go. And if we can get that right, we'll save a lot of lives. We'll actually have a lot of early interventions. For example, you were talking on this show recently about the King of England and his daughter-in-law. Yeah. They both have cancer, and the chances of survival are higher because these are early detections, and management of cancer is directly related to early detection for prevention. So for example, you found a tumor in the abdomen, you cut it out, you use chemotherapy, tumor is gone, you're back to normal, you're under surveillance. But if we didn't screen you, or if you didn't present early, there'll be metastasis all over the place. Stage 5 cancer, you're dead, every country. So prevention is tied to screening, it's tied to early, frequent, regular, full checkup. For example, a woman of your age and my age and his age, there's certain things I must check for according to your age. And so once I find those things, there are even non-cancer causes of death, like heart disease, diabetes, things like that. All these things can be 100% cured if we find them early. Not witchcraft though, not native medicine.
Let me bring in Dr. Anyaogu-Eziri into this. Now, when you talk about primary health care, the focus must also be in rural areas. So for ANPA, for instance, you're partnering with the Abia State government. About 65 of you have come to Nigeria to provide, to medical assistance, especially to areas that are not, not urban areas. What more contributions, especially from organizations like yours, what impact can you have, and what areas should be addressed, especially for rural areas, to encourage them to check for screenings, for tests, for checks, and how much money are you bringing in as well to support the government's efforts?
Thank you very much. AMPA is going to be 30 years next year, and for every year of its existence, it has embarked on medical missions. And over the years, it distilled it being able to have a specific amount of time dedicated. That's called AMPA Week, during which we perform medical, surgical, dental, ophthalmologic interventions. Over time, it's gotten a little bit more complicated and a little bit more comprehensive because the needs of the on-ground population is so great. During the time, we collaborate with the needed stakeholders. Usually, the state government is the easiest partners with which you could be able to identify and interface with the local population that requires care. And it's really interesting, and it's so heartwarming that a lot of the diaspora physicians have in their heart to give back and come to these communities where they may or may not belong. I'm not from Abia. A lot of the people that are coming aren't. And we choose where we go in a complicated process anyway that occurs over a year, and bring back the equipment and the needed medications after having done an evaluation to see what gaps are there that need to be met. Healthcare delivery is a complicated process. I mean, it requires a lot of interdisciplinary collaboration. I think that in the rural areas have the highest need, and so they have the greatest impact because you have people who could never afford the quality of care that they're given. And indeed, the true north for healthcare would be for us to be able to provide population care at a reasonable cost with a great patient experience. And part of that experience includes us being able to perform capacity building, where we have workshops to train the on-ground teams. This year, we're going to be training them on helping babies survive, which is prioritizing neonatal survival. As you can see, it's one of the top causes of mortality in our country currently. Also, advanced cardiac life support, where we'll be certifying 50 individuals and also having a sustainability process where champions can then train people after we're gone. And then also a workshop called Stop the Bleed, where, as Dr. Ugwumba had mentioned, trauma is a significant cause of injury, and the commonest preventable cause of death is from hemorrhage. And so the Stop the Bleed training, which was championed by American College of Surgeons, allows us to use evidence-based principles to teach people how to place a tourniquet and stop bleeding and save a life, irrespective of whatever they could use as a makeshift tourniquet or a real one. This is very important for the organization. The vision is a healthier Nigeria, a healthier world, and working with the different stakeholders on a federal, state, and local level allows us to be able to extend our reach. And currently what we're trying to do is to develop more sustainability projects on ground to be able to not just bring the bread, but show people how to make the bread so that the healthcare delivery is a constant continuum. We are hoping that Abia State is the beginning of us being able to do this in a more sustainable manner. And next year, when AMPA turns 30, we intend to do the same in Lagos. And we will bring our annual Scientific National Convention, which we normally have in June, with the mission to Lagos State to have a comprehensive mission and convention in 2025.
All right, Abby, thank you so much. You know, what you said was very apt. Things as some people will say it's as little as using the tourniquet properly, or things as little as a Heimlich maneuver that could save a life. People don't have skills like this. They don't even know it. And I'd like to go back to the primary healthcare sector. Correct me if I'm wrong. The primary healthcare sector looks dead to me. And I can say that for a fact because I've been doing a lot more research there lately. I am playing in that space, so I know it for a fact. In some rural areas, it looks dead. I mean, how can we resuscitate it? You'll be amazed. Most local government hospitals that are supposed to be like the first line buffer have no infrastructure, have nothing they could use. And the private sector is even taking the place of the government primary healthcare sector.
Right. This is a very tough one. I know a lot of individuals have actually, including yourself, are doing something in the health sector by building primary health centers because there's no access. There is no health center. First of all, you build, like a lot of legislators go and put health center in their budget, but they forget that the building is not going to take care of people.
Not going to take care of
You've got to have staff, you've got to have renewable equipment, you have to have supplies. And so this is a very intensive system that requires, as my colleague said, interdisciplinary people to come together to do it. Even, they don't have to be nurses. There's something called community health extension worker. They call CHOOSE. Even such low-level training can save a lot of lives because they know when to refer. And they can do like this simple tourniquet application, stop the bleed, road traffic accident, or case of tetanus. Things like that, they don't need to kill, the person don't need to die. But the health center needs to be built, it's correct, but that's not enough. And so, for example, when I was a special advisor in Delta State, we had over 400 primary health centers. And less than a third of them were functional for various reasons. Something as simple as a simple fence at night to guard. The staff was not there, so they were scared to go to work at night. And in the hinterlands, for example, you can't go because you have to go by boat. Yeah. So it has to be the health center in that place. And then they have to identify complicated cases early so they can save, for example, a woman in complicated labor. So what you're saying is absolutely right. We have to have the health center there, but we have to have them functional for any number of reasons. And that's where everyone comes together. Nigeria is a very complicated country. The government really has enough money to do everything for everyone, but we know it doesn't work often like that. So individuals come in like AMPA and other NGOs. And so everybody working together with the government is the best approach.
Okay, let's quickly come to you. I mean, things as little in this, local communities, local healthcare, primary healthcare. What can we do? What are your thoughts on this?
Innovation. Innovation. Why do I say that? Well, COVID taught us a lot. I think in the years from COVID, we've kind of like had a trajectory of improvement that we never would have seen otherwise. It's impossible, or it will be very difficult to staff rural areas with quality care professionals, because just like you and I, they want to be where they feel they have the best quality of life by choice. Now, I think that there are opportunities in us being able to navigate that, and there may be some dissension.
Yes, EMR.
Exactly. Digital health. We're talking about asynchronous visits. We're talking about synchronous visits. We're talking about using devices. You can get a lot of information by having devices worn by individuals over a period of time and then collating the information. We're talking about phone visits. There has to be an extrapolation of the care delivery outside of the face-to-face for there to be able to capture that. And I think people are willing and ready. Last year, we had a mission in Otta, and there was a young man, he had a thyroidectomy. And I remember when he was leaving, I was worried he wasn't understanding everything. So I went back to his room to talk to him about it, and his wife asked me if she could record me, and she did. And 2 months later, I was in New York, and I got a text message, and it was their path. So that means she understood. She took the instruction, they did what was needed, and they followed up with the results. And I was like, this is progress. Yeah. They may not understand English, and it may be hard for us to communicate, but we were effective in being able to solve that issue. So I think innovation is going to be the key in being able to unlock that dimension.
Innovation, funding, primary healthcare, getting all the aspects right. And then we have this opportunity in Abia State, where the experts are going to help to make a difference. Thank you very much, Dr. Anyaogu-Eziri. I got it right this time. And thank you, Professor Ugwumba, for joining us.